With the new year upon us, we're looking ahead to the medical trends that could help define the fight against the coronavirus in 2022. In 2021, the FDA authorized emergency use of 2 new COVID antiviral pills, but Dr. Anthony Fauci told CBSN Mornings vaccines and boosters are still key to protect yourself against the virus.
We're telling everybody, and I will state it very clearly now, that optimum protection is with a boost. So if you are not boosted, get boosted. What is called by definition for legal or other purposes a fully vaccinated person is in fact irrelevant. If you want to be fully protected, get boosted. I'm saying it very loud and very clear right now.
To talk more about what to expect in 2022 in the fight against COVID, I'd like to bring in CBS News Chief Medical Correspondent, Dr. Jon LaPook. Hello, sir. So,
Hello,
first question is, what are you seeing in your clinical practice with your own patients right now?
Yeah, well, I'll tell you, I'm seeing a lot of people who have had breakthrough infections. The good news is every one of them in my practice has been fully boosted, fully vaxxed, and has had a booster. And they are all doing fine. I even have 2 people who are immunocompromised, and they're doing fine. So when you hear Dr. Fauci say to make sure to get boosted, he's exactly right. The people who are out there right now saying, well, it's spreading so quickly, I can't believe I worked so hard for a year and a half to not get infected, and now I end up getting infected. No, it's congratulations. You made it. You made it to the point where you didn't get infected before you got vaccinated and boosted, because now, look at you, you're having much milder illness than people who got infected at the beginning of the pandemic. So I'm seeing a lot of people with infection, but so far, so good.
But John, there are a lot of young people right now who do not have the vaccine, particularly kids under the age of 5. They're not yet eligible for it. So when that happens, do you anticipate any sort of change in the new year, especially as things start to change in terms of new pills being offered and new vaccine eligibility?
Yeah, I do. It's a little disappointing that the initial studies for Pfizer, for example, for kids under the age of 5, the 2 doses did not elicit enough of an immune response. So they're looking at giving a 3rd dose. But you could look at it another way and say it's reassuring, because the dose they gave was 3 micrograms. To compare that with the grown-up dose, that's 30 micrograms. So they gave a 10th the dose. They were being very careful. They wanted to make sure that they try to get the dose right, not give too much. And now they're saying, all right, we're going to go back to the drawing board a little bit, maybe give a 3rd dose. Moderna, we're seeing them still recruiting. So I actually think that sometimes, fingers crossed again, that sometimes in 2022, we'll see some sort of authorization for the younger kids. That would be great.
And we mentioned earlier the FDA authorized emergency use of 2 new COVID antiviral pills. How do you think this is going to help in the fight against COVID, and who's going to benefit the most from that?
Well, initially, it's approved or it's authorized for people who are at high risk for a bad outcome from COVID. When you see the Pfizer pill, 88% decrease in hospitalization and death if given within 5 days. The Merck pill was less effective, it was about 30%, but still some good action for people who are at high risk of a bad outcome. Again, it's a good reason for people to hang in there and try to do all the measures, the mitigation that we've all talked about, vaccination, boosters, washing your hands, wearing masks, understanding that the virus is in the air, it floats across the air. So open the windows, crack the doors, use an air filter if you can. And we know about physical distancing and all the rest, and then testing as you can do it. But it's a good reason to try to do all those steps of mitigation, not get infected for now, because down the road, when the pills become more available, that could be something that may be useful for you if you do happen to get COVID in the future. Right now, there are tens of thousands of doses of the Pfizer pill that are available. In January, we're talking about hundreds of thousands expected. After that, millions. And there are millions of doses of the Merck pill that is going to be available soon, we're told. So again, another very positive development, another tool in our armamentarium against this virus.
But speaking of those tools, many of them readily available. Here we are a year out from the first vaccines being rolled out. Yet there's still around 40 million Americans who, for whatever reason, are uninterested in getting this vaccine. And we continue to top record infections. So how do you think this all bodes for the nation into 2022?
It's such a disappointment that people who are eligible for the vaccine have elected not to do it. And I think, one way or another, it's likely that people who are not vaccinated eventually will get COVID, because you see this Omicron is sweeping across the nation. You're seeing big curves up in infections. The good news so far has been that if you are vaccinated and boosted, the relative to previous versions of this virus, there was less of a risk of hospitalization and intensive care unit stay. But it's still possible to get sick and even die, and especially if you are not vaccinated. So for those people out there who are still on the fence for some reason and can possibly be persuaded, I'd like to reach out to them with empathy and start off by listening. Why aren't you getting the vaccine at this point? You've seen the data. You know that it's much more likely that you're going to die or get hospitalized if you are not vaccinated. So whether for you or even in terms of society, trying to not put a pressure on the healthcare system right now, because if you end up in the hospital, that's going to overload the system. Remember, we talked about flattening the curve at the beginning of the pandemic. Well, we need to do that right now, because people who are not vaccinated, who get infected, they end up putting a big strain on the healthcare system. And we're seeing that. We're seeing the federal aid right now to places all around the country to try to give them help, because there's such a strain on the healthcare system.
The administration has admitted shortcomings on the lack of testing, John. In Europe, where free testing is widely available, the virus spread does not seem much better than in the U.S. Plus, the FDA warns COVID-19 antigen tests might not be as reliable in terms of detecting the Omicron variant. So the big question is, how do you effectively use this sort of antigen test, maybe a rapid test, and then other testing moving forward?
Well, we were saying that before you get together with people right now in small groups, Tony Fauci said, don't think about getting together with people like 20, 30, 40 people. But if it's a smaller group with your family of loved ones and you want to get together, maybe right before you enter the front door, get tested with one of these fast antigen tests. And, it could be pretty good at knowing whether you're infectious for the next few hours. We're now starting to see with Omicron, just in the last week, to show you how things change, that there are cases where people were infected, tested negative with the home antigen test, and then maybe a couple of days later turned out that they did have COVID. It's not clear yet how infectious they were at the moment they tested negative. So I think we're still doing more studies. The FDA is looking at this very closely to see, what's the role of doing an antigen test to get out of isolation, for example. You saw the CDC said isolation is not going to be, when you leave isolation, it's not dependent on a negative antigen test. People were saying, well, why don't you get an antigen test at 5 days? And they said, well, we're not quite sure how to interpret that. So I think you have to have a lot of humility here when it comes to this virus. The one thing that's predictable is that it's unpredictable. So fingers crossed as we go forward into the new year that hopefully, one hypothesis is you're going to see a big spike up in cases and then hopefully start to come down, as we're seeing in South Africa and England. There are going to be hospitalizations, there are going to be deaths, but maybe that's our off-ramp. Maybe one hypothesis, if we don't have a variant that is more wicked than what we've already seen before and more deadly than what's happening now, we could have an off-ramp where we see, okay, there are going to be some cases, and then we get to a point where it's gone down maybe to what's called an endemic level. We're never going to totally eradicate it like smallpox, but maybe less than 10,000 cases a day, or even less than 20,000 cases a day. Now we're seeing close to 500,000 or more cases a day. And at that point, maybe this starts to be in the rearview mirror for us, and we can start getting on with a more normal life.
Hopefully so. All right, Dr. Jon LaPook, Happy New Year, sir. Thank you.
Happy New Year to you. Take care.